I have always wanted to be a nurse for as long as I can imagine. So I did start out as a nurse, as a bedside RN, and I did that for like a decade, and then it just kept going from there. I went back for master's, and now I'm a nurse practitioner with the allergy group. My passion is food allergies. So once I started seeing kids with food allergies and treating kids with food allergies, I really figured out that was the place that I wanted to be, working with those families. They'll come into the clinic, and often the first time that I'm meeting families is when we're doing a food challenge together. So, hi, how are you? My name's Tonya, and we're going to feed your kiddo something they may be allergic to today, which can be really scary for families. They come in and then they start with teeny tiny bites of the food, and we increase those bites in size as they go along throughout the day. And then we keep them in the clinic for about 2 hours of monitoring after that last bite is taken to make sure that they're out of that time period where a reaction would happen if something was going to happen. Once we know a kiddo is allergic to a food, so they've done the food challenge and they had a reaction, we know they're allergic to the food, or if they've had a convincing reaction at home, then we see that kiddo back in the clinic every 2 weeks for a period of sometimes 6 months or more to desensitize them to that food so we can get them safe in the public setting. So they become my little best friends. So they come in and it's somewhat of a, you get your dose and we have a play date for the 1 hour of observation. But the really rewarding part of this specialty is then we can offer them hope. We can do treatment and I can see them on and on and on. And I'm also there on the day that they graduate from treatment and they're eating that food and they're, doing all the good things too. Parenting is really hard. Healthcare and navigating healthcare is really hard. And having a child with food allergies is really hard. And having to make really, really big decisions for those kiddos with food allergies is even harder. So I try to be the person that is their contact. If I don't know the answer to something, let me find you someone who does. Kind of bridge the gap between all of those things because they're all hard.